Excellent. Thank you everyone for joining this very important talk about breast cancer awareness. So as women, it's important we be aware of how things happen, and at least we need to know, um, what we need to do in case if we get diagnosed with breast cancer. Unlike 30 years back, where cancer was considered to be deadly disease, where your death certificate was returned when you get detected with cancer. Um, Things have changed. Medicine has evolved so much, and especially with cancer like breast cancer, it's completely curable when detected early. So I'm going to introduce our two facilitators, Smeeta and Dr. It's very kind of her to come and share her experience. She has over 25 years of working with an oncology department. She's worked with some of the famous, well-known oncologists and the surgeons. And she's been part of several research and publications. And she's presented papers in different conferences when it comes to breast cancer and different types of cancer. So she is going to share a brief about what breast cancer is, what are the signs that you need to be in the lookout for, and her basically talk about her experience of having dealt with cancer patients over the years. And of course, all of you, and if not most of you, know about Dr. Sanyogita Nimbalkar. She's our in-house doctor, and she heads our yoga upachar. And most of you have talked to her when it comes to her aches and pains or any lifestyle disorders. So she is going to talk about in specific about the role of yoga in when it comes to the rehabilitation. So most of you are yoga practitioners. So you kind of know, but again, we're going to talk in respect to when it comes to breast cancer. So that's going to be the focus of the role of yoga that she will be talking about. Okay, so I'm going to give Smeeta the spotlight. Smeeta ji, you have the spotlight. You'll have to, you unmuted. I'm going to share your PPT so you can talk about it.
Very good evening to everyone, and thanks to all of you for me to share my knowledge and come for this topic to explain for all of us. I would request all who are going through this presentation should see and learn about how this disease actually come, and it's really very much treatable, and you can recover and be a survivor, any individual who can be a victim of this. So all of us have to strive and get this knowledge and spread all over to each individual, either it is male or female, irrespective of any sex. This disease can come to anyone. So I request everybody to carry this message to everyone and share as much as they can. I think this is a yoga PPT. We can start sharing my slides, ma'am. Jaya ma'am.
Yes, Smeeta, she's on it.
Yeah, I'm on it right now.
Right.
Okay, can you see yours?
Yes.
Okay.
So I'm working with Dr. Kopikar. He's working in cancer since 90s, and in course of his curriculum, he had come to a destination where the breast cancer had been increased in 2000. It went off tremendously to increase the breast cancer in 2014 and 15. The triple negative cancer, especially, I will be sharing this. I'll explain you the different types of cancer, what happens. So those were increased, and he started focusing only on breast cancer. And then he realized that a special way of treating the patient with all holistic look, the aesthetic part, only the cancer can be treated. So that's why he has the first message to each every female, especially, that she should not get depressed because of the cancer, and she should be really open up and come to get her treatment managed with a proper and early diagnostic. So first message is, do not get depressed when there is a lump, and just come approach to the right direction with the help of medical teams and start your treatment. Next slide, ma'am. So basically, a breast cancer, if you see the percentage, it's almost 1 woman in 4 women is the ratio currently going on for the breast cancer. In a whole lifetime, one of those 4 females in the group can have an impact of breast cancer. Either it is early or late, whatever, depends on our approach. But that's the severity of breast cancer which is going through all over the globe. And that's the reason it's very important that treatable manageable cancer, we have to do a early diagnostic. That's the reason we have to do a awareness and find out where and what is wrong with us, and we have to focus on. Next slides, please. So if we compare to the Indian population with the Western countries, there are few factors. Same time, if you compare a rural and urban scenario of Indian population, the lifestyle has been the main focus of cancer getting more into the life. Now, why? It says that your sedentary lifestyle, because more the cancer rate is seen in the urban than the rural areas, and rural has cervical cancers. So your lifestyle, the sedentary lifestyle, everything is available, there is no activity. In the rural, people are working in the farms, whole body is moved, like hair, from your hair to the nail of the toes, everything is moving. We are going to have a yoga session naturally, that will also say something about what is the importance of each cell of the body. And that's the reason the sedentary situation creates the cancer. Also in India, the breast cancer compared to the Western population has come in the early age. Previously, the cancer used to come when the hormonal changes, menopause used to happen. But now the scene is not so. It is when the lady is also in an active hormonal situation with a fit situation, but in an early age. That is the scenario in India, which in Western it is different. This is a very major concern for Indian population to think over. Then there are the people are not approaching to the medical services when the situation is in an early phase. So first, we are doing awareness, they should know when and where and who to check. And if there is any breast problem, do not hesitate, because in Indian population, as per our culture, we are very shy, we don't come out, we are very hesitant that if any health problem is there for the female, she will say, if I show any problem, if I get any disease, then all family situation will collapse, so I should keep quiet, let it go ahead. This is not the way. One should come ahead and tell the people, or tell your close people that I have so and so problem, and go to the medical service, get your diagnosis done. And if that early diagnosis happen, only the risk of mortality will be less, and you have a quality survival, free survival of cancer free survival is there. Now the second third most situation is the facilities. Indian government is still under preparation. That is the reason, one, we all, whoever are striving for a better health of the community, has to come up ahead and take a call and help out each of the individual to know that what is the best way to screen themselves for any type of disease, not only breast cancer but any medical problems. Unless the medical services are not approached properly, like government, normally in Western population, the government gives the screening programs. There are annually each individually screened, and that helps the government to treat the person in the early phase, and that is again a monetary burden, a treatment burden, a loss, torture to the health. The individual's health is also less, because if the early diagnosis, the less treatment approach is required, only surgical also can survive. So these are multiple factors which are different in urban compared to the rural, as well as the western compared to the Indian. Next slide, please, ma'am. Now let us understand what is the breast. As we know, breast is two lobular structures on our chest wall. Now on the structures, we know there is nipple. Around the nipple there is a darkest circular part which is called areola, and the skin part. Now inside in this structure there are some ducts which have lobules and which secrete milk at the time of for the nursing mothers after the delivery. Now these organs are only active when their functional requirement comes, but other times they are in the sedentary situations, and this part is supported with fat, fibrous tissues, and other other muscles. Now what happens into this structure is, the breast tissue, if you see here, uh, the slide, the breast tissues are, this is the breast structure where these are the lobules and these are the small ducts. Now normally this small duct structure is the place where most of the times, almost 95%, 90% of the cancers happens in these ducts, breast ducts. So those are evenly placed with small cell structure in this fashion, in the normal structure. But when the abnormal happening takes place, those cells become abnormal and grow this way. But these are again within the cell lines, right? So because of that, no one can make out on their with the hand or a clinical examination that there is a tumor. So one has to do a basic screening, that is, you have to do a sonography or mammography which will show what is happening inside the duct. After that, this duct, this situation of breast cancer is called as precancerous phase, and this can last from 6 years to 8 years, and it can stay as a precancerous only. But after that, some years, this will expel out to the adjacent tissue structure, and then it is called as invasive duct cancer. So invasive means it started involving in the previous slides only. So in that, if you see this third round where the cells have come out, yes, and this is called the invasive. This is a stage 1 of the cancer. Now this invasion adjacent side, here the slide is seen, the picture. From that invasive, it goes to the stream of lymphatic and blood supply, and it starts spreading around. So it becomes stage 2. So normally the tumor more than 2 centimeter is considered to be stage 2 cancer, and if the tumor is more than 5 centimeter, it is stage 3 cancer. And if the tumor is less than 2 centimeter, but these lymphatic systems which are here in the axilla, where our immune system is helpful for resisting whatever abnormal happens in the body, and that is called lymphatic system. So this lymphatic system tries to resist this abnormal happening in the body and avoid to spread it, but at some stage it will go to the lymph nodes, and in the fight the tumor may come forward and involve the lymphatic system. That time the stage will go to stage 3. Next slide, please. After that, the tumor after the node can go to the different organs of the brain also, which are the vital organs called brain, lungs, livers, bones, kidneys, and these organs, either of these organs are affected, then it is called stage 4. That is how the basic tumor staging is defined. Next slide.
Smita, can you see the next slide?
No, something went wrong.
You have the risk factors that you cannot control to prevent breast
Yes,
cancer.
yes.
That's
So,
the slide.
yeah, it had gone to drop down. So the risk factors are there. So there are two different types of risk factors. One which we can control, other which we can't control. Now, which are those which we cannot control are the factors which, like anyone who has a early menses. Nowadays, if you see the children's, we used to have our menses in the age after 13, 14, 15, but now it is like before 2 digits, like 10 years, 9 years, the children are getting their menstrual cycle started, which is a very sad part. This is again the diet habit, a lifestyle, or less activity, or hormonal imbalance. This is something to do with, but this is the fact now that each person in the each children in a female child especially has to be checked for the risk of this. Then the genetic factor, any genetic involvement, any genetic deformity inbuilt is happening in any individual's body can have a reason to develop a cancer. Then if anybody's, normally the menopause, the stopping of the menstrual cycle is 45 to 55 in between, but some females it crosses 55 years of age, so that can be a risk to get the breast cancer. Particular type of ethnic background, races do have some type of cancer to carry forward, in that few groups have breast cancer risk factors as well. In the family history, if the mother or maternal or paternal, any member of the family before age of 50 is having a breast cancer or ovarian cancer, the risk to the other people in the family is going to be high. Then the people who are uh, age elderly age can have a breast cancer risk more than the younger age. The people who work in the X-ray department, MRI department are given a radioactive dye calculation tag. Now, why? Because this radiation exposure continues during doing the test and investigations, or some people who are working in the mines, they are also exposed to multiple types of radiations. These people are also at risk, and these all risk factors are not in our control, because we there is no any solution to get away from this. So they have to screen themselves in a frequent time frame and see that if any abnormal happening is there, manage it as early as possible. Next is the controllable risk factors. Which are those? First is the your lifestyle. As I said, your sedentary lifestyle has to change. So your obesity has to be controlled, your diet pattern has to be controlled. Maintain your weight according to your height weight proportions, and the diet has to be maintained. Your lifestyle, when we are saying sedentary lifestyle, try to manage that. You keep a timer in your clock where you get up from your job. Most of the table the jobs are so much tedious that person don't have time to eat and drink also, but still one should make an effort that keep a timer of at least an hour or so, where that one person can get up from the place, take a round for 5 minutes or 2 minutes, and come back and sit on the place, which will avoid this sedentary way of sitting and making the body more towards the risk factors to invite. Then smoking and drinking by default is a risk for multiple reasons. Hormonal tablets, some people due to the hormonal imbalance of thyroid or many other problems take multiple thyroid medication, hormonal medications. So you have to concern your treating doctor and ask how frequently and which type of screening is required according to the risk of those hormonal medications. Then each female have to see that I know now everybody has to take higher education, go for their professional background, set into the job setting, have a good position, but same time the family in the right time, that is before age of 30, one has to get their family, that is childbearing age. You should finish your family planning. So your whatever kids you want to plan for your family, so get married and finish your family before age of 30. The child after 30 gives a risk for you to get the cancer of breast or any other genital organs. Then mother after the delivery, normally the females, because of their job, career and multiple factors, they don't do the breastfeeding, or the breastfeeding is done only hardly for 3 months. That's not right. Minimum 6 months, maximum a year, breastfeeding is must, which will help to control the breast cancer risk, or to get away from these risk factors. So these are the risk factors which has to be careful. Next slide, ma'am. Now, considering the diagnosis of this treatment, how one will find out that she may have something related to the breast problem is, first and the foremost, for each medical problem, a self notification. We all are our own doctors first. So your self notification, your self symptom explanation, noting your minute. So in yoga session, madam must be able to tell like how you come to know what is happening in your body also, if you really meditate the proper way. So your body changes, the minute body changes has to be observed by yourself first, and that's where your self breast examination, visible and with tactiles, are required. So visible, what are the symptoms which you can see on the breast is the change in the skin color, that is redness, any patchy look is there, you need, and which is not going after few days applying any cream or what, you need to see whether it is a sign of cancer. Then any nipple discharge, especially the discharge which is clear watercolor or red color, that is a blood red, then it is a risk factor. A straw yellowish color discharge is not a risk of breast cancer, please note, but a clear water and a red color is a risk factor for breast cancer. Any dimple, the skin was very regular, even looking, but suddenly the skin is gone down, there is a depth in the skin areas, that means the dimpling is happened and the skin is pulled inside, that may be some tumor is pulling the skin inside, so that can be a risk factor for a cancer. The nipple is retracting, nipple is going inside after, later on, it's, some people have congenitally retracted nipple, but if the tumor is there and then because of this abnormal happening, the after some years or month the nipple is slowly going inside, it is a risk for breast cancer. And naturally when you're examining, if you're feeling any lump in your hand, then it is a warning that you have to go and check the doctor whether it is a normal benign, that is non-cancerous tumor, or it is a cancer tumor. That's how these different symptoms you need to take care of. Next slide, please. We have compared these symptoms when we go to the shopping in the market. We select the lemons with a different look, then we don't take it. So these are the different looks we have to see for yourself when you are doing the breast examination. Just for that we have showed this slide. Next slide, ma'am. Let's see how we are going to do the breast examination based on this. So the first and foremost is you have to examine yourself by visual and tactile. So visual means you have to see your breast. So the best time is when you are having a bath or when you are at the rest in your bedroom and you are about to sleep. This is the right time. Also, which is the right serial time, like according to your age, is if you are less than if you are menopausal, then you can check yourself every monthly, any one time of the date, one date of the month, whichever, like starting of the month or end of the month, for menopausal people. But who have regular menses, they have to check themselves after the menstrual flow is stopped, and the 1 or 2 days you should give after the menstrual bleeding is stopped. Why? Because before the menstrual cycle, your breasts are automatically going to have a heavy and painful feeling. In that scenario, checking yourself will give a false examination results. So you should always check after your menses. How you're going to check? You have to stand in front of a mirror and put your hands on your waist and see if both the breasts are in aligned position. Then lift your both the hands up and see both the breasts are lifting evenly on the top. If one is little less, normally every female have one breast smaller than the other. They both are not always even. So that is normal, but some gross difference is seen. You have to note that. Secondly, after seeing these changes, then you have to see, press your nipple and see if any discharge is there. And for examination, you have to lift your hand, and for right breast you should check from your left breast. In that next slide, the breast has a different quadrants. So what you can do is, you have the breast is covered with your neckline. There is a bone vertical where the breast in the superior part is placed. The overall breast is occupied from your sternal line, like on your chest in the center there is a bone. From that bone to the lateral in the mid axilla, that is from your axilla down, the ribs are there till that line, and lower rib area and up there is a clavicular bone, that part. This is the whole area of your breast is occupied. Now it depends on your body. The heavy body, fatty body, the breast will be too large, and this thin people, the breast may be little smaller, will not occupy so much. But the origin of the breast is from the axilla also. So you should not skip the examination of the breast into your axilla as well. And for a moment we can drop the screen. I can show you how you're going to press yourself with an example on my hand. So can you share?
So do you want me to stop sharing right now?
Yeah, the slide
Okay.
you can stop. I'll show some thing. So normally, if all of you all see, this is the bulgy part in your hand. So all of us can try right now, because I want you all to do this breast examination on your own every month at home. So this bulgy part you can consider as your breast. So you press here superficially circular. You can feel the skin and the hair follicles, right? In a circular motion. If you go little deeper and press it more circular, you will feel the muscular part. And if you go more deeper, you feel the bone. These are the three pressures for one place of the breast you have to check, right? This is the way you will be checking your breast. Secondly, how you'll cover the complete breast. So for that, I'm showing you on my chest, like, so if this is the breast, this is the circular part of the breast. So you're placing your hand, the right hand on the left breast. You are not going to check your breast with these tips. You're going to check it with this a flat portion. How? So you're going to place them on the breast. You press these three pressures. Then you move your fingers little ahead and shift to other side, so that you're not skipping single part of the breast. And you check your whole breast in this three different direction till the axilla. Okay? And come down. And as I told you, anatomically the structure of the breast is this clavicular line. Till this part the breast is occupied. This sternal line, this is the area where the breast is occupied, and the lower line is rib here, and the laterally this part, this is the whole part where the breast is occupied based on the each body structure. So you all can check yourself every monthly this way. Okay. Yes, we can go to the slide.
Can I ask one question quickly?
Yes.
Can we hold the questions till the end, please, Nazima? Because we are quite
Okay.
a cover. Please, thank you.
Okay, no problem.
So this is how you have to check. Next slide. Now, if you are finding any doubt, you have to go and do the investigation. What are the investigations? If the age is below 40, we are going to do sonography. If the age is above 40 only, we are going to do the mammography. Mammography is, this is the way, can you see that lady? Her breast is held into two plates and the rays are, the x-rays are taken. So this is what is a mammography. So in two angles mammography is done. Now by the train, the mammography is more shifted from 2 dimension to 3 dimensions. So we'll go to the next slide. Next slide. So what happens when the rays pass, the tumor area's look is different than the normal breast tissue. But in 2D mammo, if you see here, the slide which has written 2D is not able to show the lesion there very clearly. It is showing some dot, but it is not clarifying how the dot is. The features of that are not clarified. But one can see that feature very clearly in the 3D mammo. Okay, so those the spikes coming out from that area, those are the suspicious things which are clarified. So 3D, if anyone is doing a mammography, most suggestive is a 3D mammography. So keep this in mind for the mammography purpose. Next slide. Now, if it is age below 40, we do a sonography. So normal ultrasound is done, but if something suspicious comes, the breast is too dense, then we do a automated breast volume scan, where a person, as like 3D mammo, the breast sonography is done without missing a single part. So it is a proper scanning of each and every part of the breast. It's called as automated breast volume scan, which can be done. And in advance, if required, MRI or contrast enhanced mammography is done for the suspicious lesions. Next slide. Now what is going to happen? We can see on the x-ray something is there, but unless we take that tissue out and check whatever lesion is seen, unless we check it and send it to the laboratory, we will not come to know whether it is cancer or non-cancerous. So most of the tumors are seen, if they are seen non-cancerous on the radiological signs and symptoms or features, they may directly go for surgery because they are noted as benign. That is divided as a BI-RAD categories. So BI-RADs 2 and lower than 2 are directly treated by surgery or wait and watch. But BI-RADs 2 onwards, that is 3 and 4, 3, 4 and 5, we have to do the investigation. So what are the investigation? The gold standard for investigation now is not a needle biopsy. That is, a syringe needle is put in and some particles of the tissues are taken and spread on the slides. That is called FNAC, fine needle aspiration. So that is not advisable. Now one has to take a proper core. That means little bigger needle is put in and a small chunk of a tissue is taken out and that is sent to the lab. Now why we have to do that way? Because we don't want to know only what cancer, whether it is cancer or not. One should know what type of cancer it is. Now why we should know what type of cancer it is? Because unless we don't know what type of cancer it is, whether we should proceed with any genetic testing, whether we should give any chemotherapy first, whether it is an aggressive type, that all is been observed by this type of investigations, and different markers will give us a scope to define what a treatment plan can be planned for this case. So that's why a core biopsy with a proper marker test is required. So no FNAC and core biopsy needle is required. Next slide. Now if the tumor, as I said, is not cancerous, it's a benign, then one can take out the tumor without admitting the patient in the hospital on the OPD basis. Like they can come with this needle, what you see in the screen. We put that needle and cut the tumor down and suck it out. Cut and suck it out. And the whole tumor is sucked out in a one prick, so that the patient don't have a scar on her breast. Patient can go home, no local anesthesia, there is no stay in the hospital. This all has been helpful because of this machine, which is called vacuum assisted breast excision. And that's how we are able to do this advanced way of getting rid from the benign lesions which are troublesome. This is something new I want you all to know. Next slide. These are the different instruments what you use, that sonography machine, web machine. Next slide. Now, when the tumor is diagnosed, we have the solution, that's chemotherapy or surgery, whatever, or radiation are going to happen. But it is advisable by experts that removing normally till 2000, not 2000, but 19 2000, yeah, till 2005, the normally everyone who has a breast cancer, the mastectomy was a common solution for it, that is taking out the complete breast. But now that is not the option. We have to keep the breast. So if the tumor is small, there is nothing that the patient is going to have a threatening, then normally or almost 80 to 90% patient's breast is always conserved if there is no genetic history. Why? Because the study was done which says that if you take out the breast, the person is more worried and get affected of thinking that I had a breast cancer and I lost my breast. So thought of thinking of breast cancer in mind throughout in a lifetime because of that surgery trauma itself can give a negative impact and change your body biochemistry and give a raise to increase the cancer or develop the cancer. So there is, one should see these psychological factors. That's why we prefer that the patient's breast has to be conserved some or the other way. So there are two different ways. The patient's breast is been modified in such a way that a proper aesthetic look is given with the cosmetic surgery. And secondly, instead of the mastectomy breast, the breast is taken out, but it is replaced by a implant. These are the two options can be done by the oncoplastic breast surgery. That's what has been done by my doctor, and we are doing on different advanced techniques are been found by him, where different types of surgeries are done, where patient do not have a feeling that she has undergone from the disease of breast cancer, and they live a normal life like a other person. Next slide. So normally everybody has to strive that the treatment for breast cancer is not only a target that breast cancer has to be treated, but her overall holistic care, where her psychological part, her family psychosocial, her sexual, her aesthetic look, all these factors are needed. And it has multiple factors: the family, the patient counseling, the diet habit, the lifestyle, the surrounding, the atmosphere, and the other complementary factors which we do is a diet, counseling, and yoga. Same way, now we are going to have a yoga session after my presentation. So these all factors need a comprehensive service is required whenever any victim is going to be affected by any type of disease or breast cancer as itself. Next slide, ma'am. Now, what are the impacts? Mostly what happens when the breast cancer surgery is taken place, as I said, the immune system, that is lymphatic system in the axilla, is going to be checked in. That is, the breast cancer tumor is taken out from the breast, but same time the nodes, the lymph nodes are being checked whether they are impacted, having an impact of the tumor. So during those procedure, there is a special technique we have, which is called a sentinel node, in which we give ICG dye and take out the tumor by identifying which is the affected tumor. Now, few tumor taking out will have a compensatory mechanism for that axillary dissected area. But if the tumor is involved in the lymph node, multiple nodes from the axilla at different level are taken out, especially level 1 and level 2 axilla areas. In the axilla, there are almost 60 to 70 lymph nodes. Out of that, 50% of the nodes can be taken off. Now, in this situation, the axilla serves to the breast as well as to the hand. So what happens? The hand is going to have an impact of inadequate continuity of the lymphs to flow. So, as a preventive management of lymphedema, a proper way of surgery that I have explained, that sentinel node to be checked. If involvement of tumor in the nodes is seen only, one has to do the surgery to take out the extra nodes. If those extra nodes are taken out, the lymph hand is swollen up, and that's called lymphedema, because the lymph is retaining in the hand, and that's how the normal hand gets swollen up in different phases, forming some fibrosis and accumulation of fluid and restriction of revert flow to the lymph. And that is the reason we have to do this lymphedema management, starting from the preventive management. Immediately after surgery, we give a exercise sheet where we ask the patient to do exercise. So we can see the next slide. For this exercise, we have to do a self exercise with lymphedema management. So phase 2 can be a maintenance, where we are not going to impact the hand to have a progressive impact of lymphedema. So one has to actively move, do all exercise, and give a stimulation to the hand to compensate the other lymphatic system to drain the lymph from the hand, and the hand swelling reduces. So that is one. Then some stockings are given to wear for the throughout in the daytime, which will help to reduce the lymphedema. Then proper massage to drain the lymph, that is with a manual massage by somebody has to be done. So that all the lymph is been supported to drain out, and a proper skin care to avoid the skin abrasion or scalding of the skin because of the lymphedema is required. So it depends on which stage. Now, if this lymphedema is most of the times we ask to do the primarily exercise and massage, and additionally the sleeve use. But in case the progression is too much, we suggest them by a physiotherapist to do the lymph drainage by a machine which has a pump, and it in a slow motion for 20 to 30 minutes the reverse massage is happening by a machine, because of which the lymphedema is reduced. But it will require a regular follow-up and around a month or more to reduce that lymphedema. And if still the lymphedema is not recovered, there are some surgical options, but very rarely one has to opt for that, because it doesn't have that fruitful result where the limbs are recanaled. So the lymph nodes where the lymphatic nodes are detached, they are rechanneled to the other tract, but it is very complicated procedure, so mostly those are avoided. But exercise and proper active movement and massage and use of proper sleeves is most of the times advisable for lymphedema management. Next slide. Coming to the genetic involvement, I would like to tell this slide because any of y'all have any family history where genetic involvement in paternal or maternal family history of cancer, or due to some genetic problems, individual have genetic structural problems, or there is a ovarian cancer or a pancreatic cancer, particular type of Lynch syndrome type of cancer which has a involvement of genetic involvement, have a risk of breast cancer. So how do we manage for genetically involved breast cancer? Is if there is this alarming sign of cancer in the family, one has to check whether the affected victim is involving a breast cancer genetic involvement. So genetic test of the affected person is important first, and if so, then the family members are tested according to the type of involvement in breast cancer, that is BRCA1 or BRCA2. And based on that, if you are still not having any risk of breast cancer and you are a normal, like a normal population, you are negative for mutation or genetic involvement, still the risk with the normal is 8% for the breast cancer and 1% for the ovarian cancer. So every year doing a mammography and abdominal sonography is suggested for more than 40 years of age, and less than 40 years of age the breast sonography is suggested, and MRI breast is suggested if it is a dense breast. But if the patient's family has a risk, that is a family history is there, then almost 40% of breast cancer and 11% of ovarian cancer risk is available, is going to be there. And in such a situation, every 6 monthly screening of normal individuals in the family member is required. Every annually checkup with mammography, in which annual mammography and annual after 6 months MRI of the breast is advised. If the genetic involvement is there in the family, then the risk is again higher than the non affected people. And in this scenario, the people have to do their investigation twice in a year, that means every 6 monthly. So first 6 months time they have to do a mammography, the second 6 months time they have to do a MRI of the breast, and the abdominal sonography again, and this will help to reduce. And in case it is risk is high, then once the family is completed or the age and ovarian functioning is understood, the lady can go selectively for a preventive treatment, that is bilateral mastectomy with implant, or cosmetic surgeries where the breasts are replaced by the tissue, and oophorectomy is suggested where the family history is there. So this you all should know for the risk factors, the management, so that the breast cancer does not occur again in the lifetime. That's how the genetic part is handled for family history. And as women, we all know we are active, we are dashing, we are self-made, and we are multitasking. So naturally, if anybody has any problem, also should not get depressed and manage your own treatment without any hassles and without depression like the others do in the family members, especially men. It's just to feeling something proud for all females of us. Then the second most important thing is your diet and exercise, so that there should be in your diet green leafy vegetable every day and a fruit every day, and a proper exercise minimum 30 minutes of the day is required, which will help to treat yourself more lavishly and not to treat the doctor to have his royal lifestyle. And mostly the preventive measures should be in a holistic approach, which we suggest and we do. And that's why a mental process, medical Ayurveda utilization, counseling with different genetic, social and personal individual diet practice, and not but the yoga, which will be continued by Nimbalkar madam. And that's how is my presentation completed. Thank you very much. Thank you.
Thank you so much, Smita. That was very comprehensive. It was extremely enlightening. A lot of things, though I kind of thought I knew, a lot of new things that I learned. So next I ask Sanyogita to, Sanyogita, are you there?
Yes.
You there? Okay. Hi. Go ahead and share your this thing, your PPT. She's going to talk about the role of yoga in rehabilitation.
Thank you, Smeeta, for that informative talk. And yes, what I liked is women are strong, who can handle things like what men cannot handle. All right. So most of us are yoga practitioners here. How we are going to help patients suffering from this is what I'm going to share. So sharing my PPT with you all. Can you see my screen? Great. So let's go beyond cancer with the help of yoga. So there are many questions that come to our mind when it comes to cancer, right? Whenever we see a member, whether it's in a house, whether it's in the family, there is a lot of turmoil going in their mind. Now what will happen? How will I deal with it? Will I be able to lead a normal life? That is, I think, the most important thing that they feel. We as doctors also, whenever we have to reveal the cancer word to the patients, to their friends, to their relatives, for us also it's very disheartening. It takes a very strong decision to let them even reveal the word cancer. So let us try and understand what we can do to help the member and the questions that come to them normally. Can I lead a normal life after breast cancer? I'm sure Smeeta ji will agree to this question. And this is something what comes to their mind first. So, what are the challenges that they face? The first one is pain management. Pain that is coming because of the disease, like what Smeeta ji had told. And then next is the physical toxicity of the treatment. Now, treatment is necessary, but then the side effects of treatment are again going to give the member a lot of other issues. So what are they? They are symptoms. Symptoms are what we can see, what we can feel, and what they experience. Can be simple body aches, stiffness, lethargy, fatigue, weakness because of the disease, weakness because of the treatment, and because of the medicines, the bombarding of the chemo that is happening. There is acidity, there is bloating. Depending on the constitution of the member, it can be constipation or diarrhea. Just muting everyone. Then nausea, again, side effects of medicine, loss of appetite, swelling, and many more. These, for sure, can be tackled with the practice of simple yoga. When we say we not necessarily have to do posture.
Sanyogita, unmute yourself, please. I muted everyone. Can you unmute yourself? Sorry.
So when we say yoga, not necessary we have to do some advanced posture, not necessary we have to make a jalebi of ourselves and present ourselves and be there for hours together. Okay, simple yoga which will help us to tackle the pain. Like asanas, which you are seeing on the screen. Okay, so when we say asanas, everything moves around your spine. Your spine is the most important structure of your body, right? It's called the Merudand. Okay, the Meru we know, the mountain, okay, the mighty mountain, the strong mountains which holds up everything. Same as your spine, it has the ability, it has to hold the whole body structure in one line. Okay, and now using yoga, we can move the spine in different ways, which will help to strengthen the spine. Now we see a lot of MRIs which is happening, and then because of the disease, there is degeneration of the spine happening. Because of the disease, even the natural curvatures of the spine are lost. Okay, it's very important to have those natural curvatures of the spine so that you save yourself from aches and pains. We can work, even if we have lost that, we can work on the spine by doing simple yoga postures and help us relieve of the pain. So what you're seeing on the picture is simple cat and cow, which I'm sure most of you have been doing these practices. But now those members cannot be on the floor because of the pains that they have. So we make them sit on the chair. We use props like chair, like wall, like TheraBand, and allow them to work on themselves. The next, what you see is a side bend, because they need to breathe well. So they need to work on the intercostal muscles. And this simple stretch is going to allow them to work on that. And then with the backache, this is one posture which helps to release that backache. Okay, need not go into a complete forward bend. It's just simple. Use the wall, use the chair, stretch the back, and help the member release from the backache. Then we have postures like Gomukhasana. So now, because of the operation or maybe even pre-operative, there is a lot of stiffness that is settling in, especially in the upper body. Now, to tackle this situation, we need to give them props, and with the use of the props, allow them to move the upper body, especially the shoulder joint. Then you have Pavan Muktasana, which helps to release the lower back, which helps to release the gas, the bloating, and tackle the other digestive issues. Asanas like the warrior 1, 2, 3, the Virabhadrasana series, helps you to strengthen your bones and helps you to bring the muscles also active. Again, because of long sitting hours, maybe they have to sit for their treatment, or because they have to visit the doctor frequently, they have to sit outside. So because of all those reasons, they start to get a lot of upper back stiffness also. So that can be relieved with Bhujangasana and stretching, like what you've seen doing, simple Janu Shirshasana, helps them to release, again, gastric issues and also stretch the spine. So these asanas also help to deal the symptoms of neuropathy. Okay, neuropathy sets in with these patients, which causes numbness and tingling in their hands and legs, and which gives loss of balance and coordination. Yoga has wonderful postures. I have just named a few, but yoga has wonderful postures where you work to strengthen not only your muscles, but also your joints and your bones, to work even on the nerves. There is burning, stabbing, shooting pains in the affected area. So this is all the symptoms of neuropathy, which can be tackled by practicing simple asanas, of course, with guidance. Sukshma Vyayam. So to remove stiffness and pain in small joints or in big joints. So there is a lot of liquid around these joints. And because the patient has now become immobile, they don't want to move because their movement is very painful. So this the fluid also starts to stagnate, which kind of gives them more pain. So Sukshma Vyayam is a wonderful practice to help them release this pain. It also tackles arthritis and arthralgia, which is coming because of the steroids that they are on. Surya Namaskars, all-time favorite for all of us, I'm sure. But like Smeeta ji said, we saw how lymphedema was troubling the patient, right? We believe movement is medicine and nothing like Surya Namaskars. Surya Namaskars will take care of the lymphedema and its symptoms. So I'm sure most of you all have been doing classes with us, and the importance we are giving for the lymphatic drainage and the specials that we keep having to how to move the body to remove the lymphatic stagnation. Okay. So again, for them, it becomes very difficult to do the Surya Namaskars the regular way. There are easy techniques to do the Surya Namaskars. Make them sit on the chair and follow the postures. They still get the benefits as much as we get by doing it on the floor. Again, like those were the pain management. Now that because of the chemotherapy and because of the medicine, we need to detoxify the body internally also. And for that, we have Shatkarmas, okay, cleansing techniques, which help you to cleanse the body. So when it comes to your intestines and your digestive system, your liver, it is the dhauti, the nauli, the kapalbhati, which you can do, of course, under the guidance of the expert. Jalniti is a cleansing kriya. We've seen it in COVID times. It's more for your upper respiratory tract. Tratak is for the internal cleansing. It's cleaning your eyes, it's cleaning your optic nerves, but it's cleaning your mind also. So these were the physical challenges that we saw and simple yoga asana practices that help us tackle those challenges. But there are more. It's not just the mind, it's not just the body, it is the mind also, which is getting affected, right? So manifestation of symptoms of the mind, now we cannot see, but they are experienced by the member. What are these symptoms? It's fear of, okay, now what will happen to me? It's irritability because of the repeated times they have to go to the hospital, every time they have to face the procedures. It's bound that they become irritable. Anxiety about the disease, about their children, about their people around. Apprehension, again, of the disease of them. Uncertainty, depression, like what Smeeta ji said. The first slide that she showed was, we should not let the member fall into depression. There's guilt, there's loss of self-esteem. How will I get rid of them is what the member thinks. So we believe in yoga, whatever the mind is, the body can show. Whatever the body is going through, the mind gets affected. Okay, so there's a very close connection between the mind and the body. So the cancer is in the body. Let it not enter the mind. Okay, so these psychosomatic diseases, because eventually it's not just the cancer, the other systems also hampered. Okay, so because they are thinking, because they're into all these symptoms, it's not just the cancer, they might suffer from hypertension, they might suffer from diabetes, they might suffer from asthma, breathlessness, headaches. All the other organs, other systems are also getting affected because of the psychosomatic or somatopsychic symptoms that they are going through. So for that, we have pranayama practices. Okay, pranayama practices to work on the psychosomatic mechanism and to tackle the mind and the bodily ailments. So what do? They help you to stimulate the vagus nerve. The vagus nerve is a rest, relax, and digest mode that sets into our body. Otherwise, we are into irritation, and that hampers not only the body, but also your mind. So to name a few, you have practices like sectional breathing. You have practices like Brahmari, which we know produces nitric oxide, which is a relaxant in the body. There are practices like Shitali, Sitkari, which will help tackle the acidity and other digestive issues. Practices like Kapalbhati. Kapalbhati is proved to increase the endorphin hormone in your body. Okay, so that's an anti-stress hormone. Practicing Anulom Vilom will help to balance your nadis, balance your right and the left side, balance your mind and the body. Simple, deep yogic breathing is an excellent practice, again, to stimulate the happy hormones in the body. And all this has been proved. Another very interesting work is the Kumbha, the suspension of the breath. It helps to improve not only the immunity, but also increases the organ vitality. Okay, like when Smeeta ji showed how the multi-organs were affected with cancer. Practicing as simple as Kumbhak in the comfort zone of the member will help to increase the vital capacity of the organs. Yes. What can I do for my insomnia? Okay, because of the fear, because of the depression, because of the anxiety, because of even the physical aches and pains, they have lost their sleep. So how can you help? Now, I think we should really appreciate, because yoga has done a lot of contribution in healthcare when it comes to the aspects of relaxation. Importance of sleep, because the patients have forgotten to relax themselves. And since they are agitated mentally and physically, they do not get sleep. Practices like Yoga Nidra. So what happens in Yoga Nidra? You've given instructions, and using those instructions, your mind starts to relax. Now, since the mind starts to relax, the body also relaxes. And vice versa. Because the body is relaxed, the mind will further relax. And it has been proved that practicing Yoga Nidra develops those alpha waves in the brain, which helps the body to relax. Then we have cyclic meditation, which is meditating when you are in movement. That also creates a lot of awareness in the member and relaxation. Instant relaxation techniques are more for the physical body. The first two are more for your mind. The instant relaxation technique is to let go of the lethargy, the fatigue that the member is facing. And meditation and chanting. So omkars, japas, mantras, and number of them. Your body is what? Your body is just a source of energy. Okay. And this energy responds to vibrations. So vibrations at a particular frequency has the power to remove the negativity of the body and to create a lot of positivity, giving a lot of lightness, giving a lot of relaxation to the body. So it's not only yoga shastra that is talking about, it's also the Bhagavad Gita that is talking about the same. Okay. It is the ahar, like Smeeta said, very important to take care. Ahar is Parabrahma, it's your supreme, it's as good as your medicines. So they need to take care of what they're eating, be very mindful how.
Sanyogita, we can hear you.
That is the thinking.
Okay.
What we
Um,
think.
You're breaking somewhere in between. Can you speak again, please?
So ahar is the food.
Okay,
Food is
it's good.
that we say. Food is the medicine. Then we have the vichar is
Sayogita, unmute yourself, please. I had to mute someone unmuted, so I had to mute everyone again. Yeah, we're good now.
Okay, so coming back to what Bhagavad Gita was saying, the importance of ahar. Like I said, food is Parabrahma, it's the supreme medicine. They need to take care of what they're eating, when they're eating, why they're eating. Then we have the vichar. It is what we are what we think. And whatever is going on in the mind, we saw the psychosomatic relation. It's all going to show in the body also. Then is the achar, which is about your daily routine. A fixed dinacharya, a day-to-day practice, a routine is certainly going to help them tackle their mental and their physical issues. Last is the vihar. So that is the rest, relaxation, and recreation time. Encourage them to have hobbies, to have a social life, to go out, to meet people, and very important, to learn the art of letting go. This, we call it as a disease reversible program, which eventually will make them stronger to face the issues. And this is something I think you all can answer. You all can let us know when they ask us, can I practice yoga? Okay, like we said, yoga is not about the aesthetics of the posture, not about making jalebi of yourself. Like Smeeta ji said, 30 minutes of simple practices done every day with a fixed routine under the guidance of an expert is going to help them tackle their issues. So when I was reading about cancer, I came across her lecture. She is Sonali Bengre, an actress. She was taking care of her food habits. She had a good regime. She used to exercise properly. Her lifestyle was very well taken care of. And one day she was diagnosed with cancer, 4th stage, breast cancer. Okay, so that's a story on YouTube of how she has tackled herself, how she has handled, and how she has flipped the script. Okay, so you never know what is going to happen, when it's going to happen, why it's going to happen. You just have to have courage to face it, have confidence to accept it, and control. So take life in your control, and then you will be able to rub cancer. Thank you. That was
Can you stop sharing? Yeah. Thank you so much, Sayogita. And now, if you have any questions, I know we've gone beyond our allocated 1 hour. We had a 5 to 10 minute late start. So if we can quickly, Nazima, if you can ask your question now to Smeeta or Sayogita, tell them who you're asking the question to so they can answer.
Okay. I have question for Smita. Like she had mentioned about MRI and mammography. So why one should do both things? Like what is the difference that I want to know?
Yeah, right. So it is only indicated for the cases where the minute structure has to be monitored with different techniques of imaging. Now, Mammography is an X-ray technique, whereas MRI has a radioactive with a dye. Now, MRI has a small, since we know that breast is a small tissue, right? These are small soft tissue structure. So MRI has a very good capacity to capture the minute differentiation in those small soft tissues, and that's the reason the MRI is been advised for those who have a genetically impacted family history, strong family history, and their own genetic test has shown the risk of breast cancer. That means the BRCA test is positive. We suggest them that they have to do screening twice in a year. That is, once they have to do a mammography, and the one after 6 months they have to do a MRI breast. It is just to clarify that the both the imaging are going to give us the comparative clear picture. That's the reason. Like, in case if some sort of technique is going to lack the visualization, but now instead of MRI, as I told you, we have a contrast enhanced mammography. Like 3D mammography is done with same way like a MRI, where we give a dye. So the contrast dye is pushed and the patient is done the mammography during that time frame, so that the dye is in the breast area and we can visualize if anything which is suspicious can be captured because of the dye. So that is the reason the MRI was advised, that with the dye the more evidence of suspicious lesion get eliminated on the radioactive situation. Okay.
Thank you so much. Yeah, that was very informative.
Anyone else? Any other question?
Nowadays, they say it's marriage at 18 and mammogram at 40. Right, Smeeta ji?
Yes.
Any other question? Anyone else? Okay, excellent. Thank you so much again, Smita and Sanyogita, for very, very valuable information. I think all of us have an idea of how we need to be aware, how to do the self-exam and why it is very important to do the self-exam. And irrespective of what you do, continue your yoga practice. We are doing something good for ourselves, for not just for the current situation, but also for our future. So continue your yoga practice and stay healthy and stay happy. Thank you everyone for joining.